Zolpidem is a sedative hypnotic used for the short-term treatment of insomnia to improve sleep latency. In this video, let's found. What is Zolpidem? What is Zolpidem used for? Contraindication. What are the side effects of taking Zolpidem? How does Zolpidem work? How to use Zolpidem? What is Zolpidem? Zolpidem, sold under the brand name Ambien among others, is a medication primarily used for the short-term treatment of sleeping problems. Guidelines recommend that it be used only after cognitive behavioral therapy for insomnia and behavioral changes, such as sleep hygiene, have been tried. Zolpidem was approved for medical use in the United States in 1992. It became available as a generic medication in 2007. More than 10 million prescriptions are filled each year in the United States, making it one of the most commonly used treatments for sleeping problems. In 2020, it was the 37th most commonly prescribed medication in the United States, with more than 14 million prescriptions. What is Zolpidem used for? This drug is indicated for the short-term treatment of insomnia in adults characterized by difficulties with sleep initiation. Contraindication. Zolpidem should not be taken by people with obstructive sleep apnea, myasthenia gravis, severe liver disease, respiratory depression, or by children, or people with psychotic illnesses. It should not be taken by people who are or have been addicted to other substances. Side effects. The most common adverse effects of short-term use include headache, reported by 7% of people in clinical trials, drowsiness, 2%, dizziness, 1%, and diarrhea, 1%. The most common side effects of long-term use included drowsiness, 8%, dizziness, 5%, allergy, 4%, sinusitis, 4%, back pain, 3%, diarrhea, 3%, drugged feeling, 3%, dry mouth, 3%, lethargy, 3%, sore throat, 3%, abdominal pain, 2%, constipation, 2%, heart palpitations, 2%, lightheadedness, 2%, rash, 2%, abnormal dreams, 1%, amnesia, 1%, chest pain, 1%, depression, 1%, flu-like symptoms, 1%, and sleep disorder, 1%. Pharmacodynamic. This drug has CNS depressant effects, which may include somnolence, decreased alertness, sedation, drowsiness, dizziness, and other changes in psychomotor function. Due to the above effects, the FDA has recommended an initial dose of Zolpidem, immediate acting, is a single dose of 5 mg for women and a single dose of 5 or 10 mg for men, immediately before bedtime with at least 7 to 8 hours remaining before the planned time of awakening. Refer to product labeling for detailed information. Mechanism of action. Zolpidem, the active moiety of Zolpidem tartrate, is a hypnotic substance with a chemical structure that is not related to the structure benzodiazepines, barbiturates, pyrrolopyrazines, pyrazolopyrimidines, or other drugs exerting hypnotic effects. It interacts with a GABA receptor complex and shares various pharmacological properties with the benzodiazepine class of drugs. Subunit binding of the GABA receptor chloride channel macromolecular complex is thought to lead to the sedative, anticonvulsant, anxiolytic, and myorelaxant drug effects of Zolpidem. The main regulatory site of the GABA receptor complex can be found on its alpha subunit and is called the benzodiazepine, BZ, or omega receptor. At least 3 different subtypes of the omega receptor have been identified to this date. Half-life. The average Zolpidem elimination half-life was 2.6 and 2.5 hours, for the 5 and 10 mg tablets, respectively. Dose. Insomnia, sleep onset and maintenance. Indicated for insomnia characterized by difficulties with sleep onset and/or sleep maintenance, as measured by wake time after sleep onset. Immediate release tablet, sublingual tablet, and oral spray. Dosing for PO, Ambien SL, Edluar, and oral spray, Zolpimist. Women, 5 mg PO/SL/oral spray, QHS. Men, consider 5 mg PO/SL/oral spray QHS, may use 10 mg PO/SL/oral spray QS if needed. Extended release, Ambien CR. Women, 6.25 mg PO/QHS. Men, consider 6.25 mg PO/QHS, may use 12.5 mg PO/QHS, not to exceed 12.5 mg per day. Insomnia, middle of night awakening. Intermezzo only. Indicated for insomnia when a middle of the night awakening is followed by difficulty returning to sleep. Women, 1.75 mg SLPRN, not to exceed 1 dose/night. Men, 3.5 mg LPRN, not to exceed 1 dose/night. Safety advice. Zolpidem is an FDA pregnancy category C drug. The FDA categories are based on research currently available, including research from animal studies and human research. Dose. Insomnia, sleep onset and maintenance. Indicated for insomnia characterized by difficulties with sleep onset and/or sleep maintenance, as measured by wake time after sleep onset. Immediate release tablet, sublingual tablet, and oral spray. Dosing for PO, Ambien SL, Edluar, and oral spray, Zolpimist. Women, 5 mg PO/SL/oral spray QHS. Men, consider 5 mg PO/SL/oral spray QHS, may use 10 mg PO/SL/oral spray QS if needed. Extended release, Ambien CR. Women, 6.25 mg PO/QHS. Men, consider 6.25 mg PO/QHS, may use 12.5 mg PO/QHS, not to exceed 12.5 mg per day. Insomnia, middle of night awakening. Intermezzo only. Indicated for insomnia when a middle of the night awakening is followed by difficulty returning to sleep. Women, 1.75 mg SLPRN, not to exceed 1 dose/night. Men, 3.5 mg LPRN, not to exceed 1 dose/night.